Well, if you happen to have an irregular heartbeat, you may be surprised to learn how many others do as well.
And I was surprised to learn because between 2.7 to 6.1 million people suffer from arrhythmia. And to make things a lot worse, there is a specific kind of arrhythmia that could increase your risk of other diseases like dementia or Alzheimer's. Sunrise reporter Roland Rodriguez joins us now live from the Corpus Christi Medical Center Bay Area to tell us a little more about it this morning. Good morning, Roland.
Good morning, guys, and good morning, South Texas. As you mentioned, this is a lot more common than people think, but there is good news. If this disease is spotted early enough, doctors can help reduce the onset of dementia. Those with a particular kind of irregular heartbeat known as atrial fibrillation may be surprised to know that this disease is very common.
It's actually very common in the elderly. When you define elderly over 65, 9%, 1 out of every 10 will have atrial fibrillation. When you're less than 65, only about 2% have atrial fibrillation.
If you have atrial fibrillation, what happens is that the top chambers of the heart atrium stop squeezing.
And there are two issues with it. One, it makes the heart rate go very fast. Two, you can have strokes from clots forming in the atrium.
People with atrial fibrillation may experience a much quicker decline in memory skills and have a greater risk of dementia.
Two most common causes of dementia is vascular dementia, where from strokes, and the other thing is from Alzheimer's. Both are seen to be increased in patients of atrial fibrillation.
Spotting the disease early could help reduce the onset of dementia.
Our job is to educate patients to come and seek care when they have atrial fibrillation, stress the importance of taking blood thinners, and there are now alternatives for atrial fibrillation on patients who can't take blood thinners, and nowadays we're starting to ablate patients with AFib, actually cure it, and this can all be done at the Corpus Christi Medical Center.
Risk factors are similar for both the diseases and include age, weight, hypertension, high cholesterol, and diabetes.
So the symptoms of irregular heartbeat, palpitations, shortness of breath. Some people have chest pains. Unfortunately, 1 in 10 may not have any symptoms and may be found when they go to see their doctor.
Let me also add that more than 700,000 patients or people with this condition are hospitalized every year. Of course, we'll have more information later this morning on our website at KRISTV.com. Guys?
All right, good stuff. Thank you, Roland, for that information. You know, we've been